Do you want to race? Because people have been challenging me to races, and I feel like
Yeah, let's do it, man. Let's do it.
if I win, I get to own this pharmacy.
If you want to manage all the stress that comes with it too, I don't mind giving it to you.
Welcome to OD Podcast. This is your host, Phit Pharmacist. Today, we have a special guest. We are joining here in Agerite Pharmacy in Cypress, Texas. This is Cypress, Texas, right? And we're here with Dr. Glenn Amakwe. So Glenn is a pharmacist, entrepreneur, and we are joining him at this beautiful establishment that him and his wife created.
My name is Glenn, Dr. Glenn Amakwe, one of the co-owners here of Agerite Pharmacy and Wellness. It's a pleasure to have ODPOD out here today at Agerite Pharmacy. Walter is a great friend. He's also doing great things in the medical field. Can't wait to see where we go from here.
You worked in the pharmacy field for many years. Next thing you're going to do is open a pharmacy. Why would you do something so crazy? Like, why would you want to open your own pharmacy and continue the abuse that you've been feeling before?
I guess the natural answer would be, why not? Coming out of pharmacy school, I went to a great pharmacy school, Texas Southern University. 16 months of retail pharmacy, and that's where a whole lot of that abuse came from, even though I still enjoyed taking care of my patients, the clients that came there. But I felt like I was a pure vending machine. I did that for a while, transitioned to clinical pharmacy at a hospital here at Harris Health in Houston. It's one of the biggest hospital facilities here in Houston. I still find purpose in what I did at the hospital level. Great work environment, taking care of a certain group of people, but still I just didn't feel fulfilled. I wanted something for myself, and it's something I've always dreamt about, creating for myself, bringing something of value to the world, and having control of it. So pharmacy was what I know and what I knew very well. I didn't want to become a crypto trader, a crypto bro. I didn't want to become a crypto bro. So I focused on what I already knew and wanted to bring value in that area. So that's why I went into pharmacy. Obviously, it took me a while. My wife and it took a while also to convince my wife to get into that mindset of ownership, of creating our own thing. It's a lot of work, but I found fulfillment on a daily basis in what I've created with Agerite Pharmacy.
What services do you offer here?
So like I did mention, we're definitely not a pure vending machine facility type of pharmacy. We're not just an ordinary pharmacy. We focus mainly on wellness, and I know that word is cliche, but pretty much what it is helping people make a decision on their health and customizing their health, making it bespoke, specific to a patient or a client, because not everybody is the same. Obviously, we do have prescriptions that are out there that are made for everybody, but everybody is not the same. So we focus on customizing medication for clients. We also have a wellness center. So when you come into our space, we're doing labs. We're making sure we're seeing the big picture of what's going on, making sure your labs are okay, making sure that your hormones are fine, and we are making the drugs or the medications in-house. So we focus on compounding both sterile and non-sterile medication, aesthetic type treatment, which is mostly done here at our wellness center. We have an in-house nurse practitioner that focuses on IV hydration and hormone optimization. We also do therapies that are not easily accessible to clients, like PRP. We make sure we provide all this at an affordable price to our clients.
Which do you prefer? Do you prefer the community setting? Do you prefer the hospital setting? Compounding? What practice do you prefer?
Each setting brings its own challenges. I don't have a preference. As long as I'm actually providing value wherever I'm at, that's where I feel more comfortable. When I was at retail, there were definitely a lot of positives to it, You did get your instant gratification with actually having interactions with patients that you help. There's fulfillment in actually dealing face to face with the patients. But however, at the hospital level, you're not getting to see the patients face to face. You're mostly working in the pharmacy, unless you do get to go to the floor sometimes, but not a lot of patient to patient or client to client interaction. Which kind of, so I kind of seen both worlds. So what I'm doing right now with Agerite Pharmacy kind of helps me to experience both worlds. So I'm getting to see and interact with patients face to face like I used to in retail, and but I'm not bombarded like in your regular retail stores. So I do have enough time to also look in depth on the clinical side, and review a patient and also take care of them. I'm also doing compounding, so that gives me enough time to also stay efficient or on board with actually doing the compounding side of things as well. So if you ask me, I would say they both retail, hospital, they have their benefits, and they have their cons and their pros and their cons. But for me, I do enjoy the interactions that I have with patients, especially the fact that I do get that fulfillment in seeing them on a daily basis and not just being detached like in the hospital setting.
So this is the question I ask a lot of entrepreneurs. What made you make the jump? What was that? Was it a light bulb moment? Did it all of a sudden click? Was it something that you always wanted to do, but maybe put away? What made you say, you know what, now is the time?
The word entrepreneurship, I actually didn't know what that word really meant. All I knew is that I wanted my independence. That's kind of loud, but hopefully. No, this sound good. Oh, this sound, that fridge is not killing it, right? Okay. Well, so the word entrepreneurship, I'm just figuring out exactly what it means. All I knew is that the fact that I wanted my own independence, independence in what I knew how to do. So pretty much my skill or my craft is pharmacy. So I wanted to bring value to the world in some way, and control my independence and not just, do it under a canopy. Because there's so much you can do when you work for somebody or you're under somebody. Yes, you can find purpose and value doing that as well, but I wanted to do it at my own pace. It did take a while. Definitely, it's something that has been in my thought process for a long time. Like I mentioned, I'm married to a great woman. We did take our time. It did take a little bit of time to get her on board as well. But finally, when she got on board, we were ready to go. Obviously, taking a step with entrepreneurship is not an easy fit. It does require a lot of faith, time, obviously the money. You do need the finances, of course. We did get a lot of mentorship. Things. I believe that things kind of fell into place once we started making that first step, started making that first move. It's not like we had it all figured out. We just started making steps, and serendipity, somehow we found our way as we made those faith steps. So I still don't see myself as an entrepreneur, because sometimes I still have my full-time, part-time at this time job, where I still go out and practice on a clinical level. However, I find fulfillment whenever I'm here at Agerite Pharmacy, and it's grown on a monthly basis. We've been open just for about 8 months now, and we've seen the growth and the amount of value that we're able to provide with the niche that we found.
That's very powerful insight. I know for me, even starting a business, there's a lot of challenges you have to go through. But once, I guess the pride that I feel when I have my own business or when I'm, working on my craft is that, it's your own. Like you mentioned, no off camera, You mentioned, self fulfillment, self development. You develop a lot of skills, that you didn't know you even had. Being an entrepreneur is a lot of work. It's a lot of work that people don't even. I know you know this already. There's a lot of work and sweat and tears that goes behind, this having your own business, creating your own brand, and being an entrepreneur. So that's a lot of the hidden things that people don't understand. So I'm glad you touched on that point.
In regards to being independent and owning your own entrepreneurship, so we do. I believe my why for doing it is time independence or time freedom, and also financial freedom, because the way the system is set up, I don't think I would have financial freedom until I'm 105 if I kept going the way I'm going. That's another area. Definitely my family, my kids, having that time with them, spending that time with them, and I don't want to be 65 and still having to ask my supervisor for a 2 weeks PTO. So that's the time freedom factor. Yes, there's a lot of work, there's a lot of tears, there's a lot of, things that we don't, that are not glamorized, that goes into owning your own. You wear so many hats, but like Walter did say, you push yourself and realize how much you have inside of you, and you find fulfillment, and you discover yourself while you chase after your dreams.
So if I came to your pharmacy with a prescription of, let's say, 500 tablets of Norco, will you fill that for me? Will I be able to leave your pharmacy with 500 tablets of narcotics?
And I'm a little bit too pretty to go to jail, bro. But yeah, definitely not. We actually do have a process here where we don't do narcotics. If you go through our prescriptions, we do a little bit of prescriptions, but it's mostly cash paid. And the only suppliers that we do provide controls from is just one supplier, and we don't even carry most of the controls. So it's based on need. So if there's a patient that needs a control, say a cancer patient, oncology patient that actually does need it, we will make sure we do a thorough investigation with the doctor, and also find out about their diagnosis before we can actually order the narcotics. It's not worth it. There's a lot of pill mills out there. Open up a pharmacy just to dispense narcotics and put it out there in the streets. That's not what Agerite represents. We represent helping people get on a journey of wellness and helping them age right and age well.
So yes.
Hell no.
So you heard it, guys. You cannot come here with any type of prescription. Things are vetted here, fortunately or unfortunately for some. So off camera, we're talking about GLPs and GLP-1s, and we've seen a big surge of people prescribing GLPs. I'm all for it. I'm a advocate of GLPs. I believe that it's a pretty good drug. It works. We've seen the effects. Now we've seen a lot of prescribers. They're prescribing it. People use it on label, off label. There's like we said, just for the viewing audience, GLPs are typically used for weight loss. But it's used for diabetics to help control your blood sugar, help control A1C, keep the A1C down. But we've seen a big surge of people prescribing it for weight loss. I'm a proponent of it. I definitely agree with people prescribing it for weight loss. I want to hear your viewpoint as a pharmacist. You have this. You run Agerite Pharmacy, and you advocate for wellness in your pharmacy. What is your viewpoint of GLP-1s being prescribed? Are you for it? Are you against it? What do you think about it?
So GLP-1s, I think that's a great drug. It's an amazing medication since I would say it's probably one of the best drugs out there since Viagra. It's, because I mean, if you look at our society, where we are now with obesity, it's almost like an epidemic. You have a lot of people that are overweight, and I would say 3 or 5 of the main diseases that affects people, hypertension, blood pressure, diabetes, it all involves being overweight. So pretty much when you have a medication that literally has 0 to no side effects and can help you get on a journey of losing weight, and you can literally lose 8 to 10 pounds in less than 2 weeks with no side effects. I've noticed a lot of our clients that come in with a little bit of confidence issue, even having to go to the gym. They just need a jump start. They just need a jump start. And if you can take something that has little to no side effects that can help you lose a good amount of weight to get you on that journey of, okay, getting into a steady lifestyle, well, a consistent lifestyle of eating better, working out. We've literally seen clients and patients go from, I don't go to the gym at all, to, whoa, I've lost 15, 20 pounds in the first 3 weeks. Now you see them showing up riding their bike. Literally, one of our clients came here riding a bike that he had left in a garage for years because he got motivated. And so the GLP-1s are great. They're great medication. You're losing weight extensively, but we make sure we advise our clients to also incorporate lifestyle modifications, eating right, working out. But we do understand that they need that first boost of, okay, I'm going to shed this first 20 pounds to help me get that confidence to maybe just go back to the gym or, start eating right. So yeah, I'm all for it.
If you go on social media, there's people are for it, people are against it. There's a lot of conversation around GLPs. Luckily, we've seen the results. We've seen it trending. I think it was around, after COVID, we saw a big surge on TikTok. Everybody was saying, oh, I use Ozempic. Ozempic does this. Ozempic does that. A lot of my content, even some of my viral content that was centered around Ozempic, was centered around Manjaro. It was a very trendy drug. You also supply GLP-1s here as well, right?
Yes, we do. It's one of the medications that we do provide as a bespoke medication to our clients. We obviously make GLP-1s that are non-commercially available. We make sure that we're not comparable to what is out there. And like I said, it's a great medication. It provides the confidence that we pretty much see the confidence or see our clients light up in less than 2 months of being on GLP-1s. And yes, we do provide.
If you were a drug, which drug would you be? I'm probably be, for me, I guess my personality would probably be, I want to say Xanax. Maybe, I need some melatonin. I need to sleep. I definitely need to chill more and sleep more. If you were a drug, what would it be?
That's actually a great question. I've never really put a lot of thoughts to that. Can I pick more than one?
Sure, go ahead.
Okay, good. Well, I would say GLP-1s for one. Yeah, we just talked about GLP-1s, right? Exactly. But why would I want to be GLP-1? Because clearly, losing weight loss is definitely something that can help. Give you confidence.
You're a helper, you're a confidence booster.
Exactly. So I want to be confident. I want to show up, look good, feel good, play good. And also, I would say Tylenol. Why would I say Tylenol? Because, you know, just I'm easy. I'm easy as it goes. I don't stress too much about stuff. So I reduce. I kind of.
Well, so you say you're Tylenol because you're easy to use and you're hard on the liver.
No. No, that's a bad example.
What is the most overrated drug that you could think of? And then two, which is the worst drug to count, smell, feel? Like what drug do you hate the most? I know for me, the drug I hate the most is Tessalon pearls or benzonatate. I hate benzonatate to a passion. It's hard to count. It's hard to look at. I mean, it don't smell that bad, but I hate that drug with all my heart. I haven't taken benzonatate before, but a lot of patients tell me that, with their experience, not mine, but what they say, not mine, they haven't seen much effect from it. So it's like, why are we still feeling this drug? It's hard to count. Everybody hates it. All the techs I work with hate it. I hate it. Let's just get rid of it.
Okay. Well, it's funny you took Tessalon off the top of the list. Yeah, it's definitely one of those evil drugs to count. It's always moving everywhere. Yeah, and it drops off your counting tray and all that good stuff. So, but smell wise, those fish supplements sometimes. Yeah, the fish oils. Yeah, those are terrible. Yeah, they have those weird smell. And then I believe, I'm trying to think which one. There's this, is the B paradoxin. It has like a really bad smell to it as well.
No, metformin has a fishy smell too. 500 has a fishy smell.
That is correct. So yeah, those drugs I don't really enjoy counting, or just the smell. It's So
we're good on benzonatate. We should just eliminate benzonatate.
Yeah.
From complete. Just eliminate benzonatate.
Yeah, I don't want the manufacturers to get us, but yeah, you can do something else.
You heard it here, folks. So benzonatate, probably the worst drug ever made to man, for pharmacists at least, for pharmacists. So let's just get rid of it. All right, so that's one vote. I'm going to ask every pharmacist this question. I'm going to ask everybody this question. Prescribers, it's just hard for us to count. We don't like this drug. Just stop it. Just stop it. Okay, so you own this pharmacy a few months. You've been working, grinding out. Have you had any success stories? Any patients that came to you saying, any life-changing stories? If not, have you, is that something you're looking forward to? Have you heard other success stories, from prescribers that called you and say, hey, this patient really liked what you did? What are some success stories that you can share for us?
So like I said earlier, instant gratification, fulfillment in what we do here. And we've gotten a lot of reviews and patient coming in and letting us know that, for one, the GLP-1s were very helpful for them losing weight. You could see the change in their continence. They're losing weight. They're changing their wardrobe. That's definitely something that that we find that gives us a reason to show up on a daily basis. I could remember a story of one of our actual clients that has lost almost 50 pounds. Yes, almost 50 pounds. And she's probably one of our second clients, if not the first. So yes, she's been on that journey now for about 6 months, 8 months, if I'm not mistaken. And that's definitely one of the stories I can remember. I also do remember a story with one of our clients that needed a compounded guanfacine for their autistic child. This client actually could not get this prescription written for them by their primary care provider. Again, sick care, not health care, even though there are research out there that shows that these medications do help. She called us and wanted us to know if she could talk to our nurse practitioner to prescribe. However, I did recommend her to call a functional medicine doctor. She was able to get a functional medicine doctor to do a frat test on the child, and we haven't seen her yet. This has been about 3 weeks now, off the top of my head, and hopefully once the test comes back, we'll be able to provide her with a custom medication that could help her child.
That's very inspiring. I mean, as healthcare professionals, people think, oh, it's all for the money, but we really take pride in what we do. We got into this profession to help people. So, and then when we actually have a chance to help people, that's all we need. That's what really keeps us going. That's a very inspiring story. I'm sure you have many of those. Working with your background, you've worked in community setting for years, and it's a very fulfilling role. It's a very fulfilling profession to do, and you've taken that to another level by having your own business. We're getting towards the end of the podcast. A few more questions. Do you think you're better than everybody else? Who gave you the right? Do you think you're better than other community farmers? Do you think you're better than other retail chains? Like, who gave you the right? And how do you respond to that?
But by the way, so nobody gave us the right, but it's just finding purpose in what you do. I believe we are probably one of the few pharmacists that have both a wellness pharmacy, a sterile compounding, and a non-sterile compounding in one house. So it's kind of a health hub. We're definitely different than your regular retail pharmacies out there. So we really didn't need any permission to do it, but we definitely didn't want to do it like what we had out there. We wanted to do something different, and it did. We brought in all our experiences from every other area that we had, both retail, hospital, and also independent pharmacy. So yeah.
Do you have any advice to anybody in the medical field, anybody in healthcare? Any advice to someone that they've been sitting on an idea for years, months, whatever? Any advice to that person to finally make the jump? You mentioned earlier, what made you, make that jump. Some people hesitate to make the jump. It could be for all types of reasons. Financial, it could be mental. It could be most of the times it's always what's between the head, right? So at the end of the day, you have to either you jump, you swim, or you sink, or you just don't jump at all. You play it safe, and you never take the chance. So any advice to you stay in that same loop. So any advice to that person? It could be a healthcare professional that's interested in the arts, interested in music, fashion. They have other passions. Yours was entrepreneurship. What advice would you give that person to finally make that jump?
I've been doing this for just 8 months now. I don't know if I have the expertise to give advice, but one thing I would say is, follow your heart. It's never going to be perfect before you make that decision. Just, take the jump. Somehow you find your way on the journey. You can't find your way sitting down. You need to start making one step at a time. And the progress, it's not going to happen in one day. We're still trying to figure it out on a daily basis. One thing we do is just give ourselves the grace to make 1% improvements on a daily basis. It could be anything. Just because you're a pharmacist or a doctor doesn't mean that you can't have a podcast, or doesn't mean you can't have bring value to the world in some way. If I was still 22, I would have probably played professional soccer. Those are part of the things that I was really passionate about.
Not too late.
Oh yeah. I think it's late now. Yeah, I'm 42 in August. It's part of the wellness journey. I try to stay, fit. So even being in the fitness industry, that's another thing. Just because you're a doctor doesn't mean you can't, share your advice on social media on things that you do to stay fit, diet-wise. So just my overall my thing would be not to wait for it to be all perfect before you make that step. Just jump out, and God, creator of the universe, somehow finds you when you start that journey. You cannot sit and expect it to happen. And it will never be perfect. The journey will never be perfect. But believe me, even if it's on the finances side, there are people out there that are looking for people with good ideas to invest in. So don't let your mind stop you from making a decision. Sometimes you just have to just shut off your mind and have a plan. It's not going to be a perfect plan, and just step out.
All right, that was I had an Amber Alert or child abduction alert. Hopefully they find that kid. Shout out to those people. Well, guys, not shout out to the kidnapper. Shout out to whoever helps find them. And if I see that brown truck, I'm sure I'm gonna alert somebody. All right, or white van. Thanks, Glenn, for coming to the podcast. ODPOD, Agerite Pharmacy in Cypress, Texas. Last question: do you want to race? Because people have been challenging me to races, and I feel like
yeah, let's do it, man. Let's do it.
If I win, I get to own this pharmacy.
If you want to manage all the stress that comes with it too, I don't mind giving it to you.
I can't believe I'm not real.